Hey, what's going on, Cpap Nation? COVID-19, coronavirus, and Cpap. I'm going to be sharing my pro tips on how you guys can stay safe, hygienic, and healthy, whether you're a new Cpap user or you're an advanced Cpap user. You guys have to be careful. Stay tuned. I'm going to get right into this. Tip number one, guys. Always take any advice, whether it's from this channel, other channels, your durable medical equipment provider, and run it through your primary care physician. Tip number two, for you newbies out there who are getting new Cpap machines, number one, I would suggest trying to go down telehealth. A lot of insurances, including Medicare and Medicaid programs, I see that they approve telehealth. And that means that you may do video conferencing on a Cpap setup versus meeting somebody like me one-on-one, because since March 16th, I stopped doing one-on-one visits. My staff stopped doing one-on-one visits because of COVID-19. So I would suggest doing that. They may say, well, I'm wearing a mask, you guys are wearing a mask. You don't know if the patients before you guys had it on their hands. It's getting on the practitioner's hands. They're handling Cpap equipment. They're handling open boxes. They're handling your Cpap machine. I believe it's high risk. So if you guys can get your Cpap machine dropped off to you at the door, delivered, whatever, and do a setup through telehealth, that's great. If they don't have telehealth options and they do in-home delivery, I would suggest having them leave it at the door and doing it through a window. We do it here for first-time Cpap users. We'll educate through the door. We'll bring a chair outside, patient is outside, and we're doing one-on-one through the window. That's a last case alternative. I suggest you guys do that. Number three, make sure you didn't get a used machine. Another video I did was talking about fleet machines. So for you guys who haven't seen the other video, it's basically a used machine. There's a lot going out there. And one comment was, well, why don't you show them how to access the blower hours so they can verify right away whether or not they got a used one? And you know something? That's a fantastic idea. So right now, I'm going to show you on the AirSense 10 on Resmed and the Philips Respironics DreamStation. Chances are you got one of those two machines. I'm going to show you how to access the blower hours immediately. So when you get that machine, turn it on, access the blower hours, and make sure it's new. So for you guys who have the DreamStation, you're going to take the ramp button up here. You're going to take this big button. You're going to press in both buttons simultaneously until about 5 seconds or so. You're going to get a drop-down menu, and then you're just going to turn the knob until you hit Info. Then you're going to click on Info. You're going to see therapy hours there. You're going to scroll, and then you're going to see machine hours with blower hours. As you can see, this is a brand new machine, 0.0, 0.0. Okay, guys, so for the Resmed device, you're going to hit this home button here and the big button, and you're going to hold them in simultaneously. It's going to be like the DreamStation, a couple of seconds. You go to the clinical menu, and then you're going to go into settings. You're going to scroll all the way down until you hit About. You're going to click on About. Then all of a sudden, you're going to see the serial number, and you're going to see run hours. As you can see, this device has 410 run hours. If you guys get a device where you see those run hours like that, you need to return the machine. You need to ask for a new one, because why would you want to use a used machine when you went through your insurance, Medicare, Medicaid, or you paid cash for a brand new one? And trust me, people in this industry do a great job by making these machines look brand new, even though they aren't. Tip number four, guys, join Cpap Nation on Facebook. It's a group that we've organized where you guys can talk to each other. I contribute into the group, so do a lot of other respiratory therapists, including Natalia, including Monica, amongst other people. It's growing. Your questions that you have for me, you can ask on there. You can ask through YouTube. I get a lot of emails. I get a lot of phone calls. And sometimes your questions are the same exact questions that other people have. I would suggest joining that group. It's like a great support group, especially for you guys who are having trouble. These support groups help. I put a link in the description for you guys to join Cpap Nation. Tip number five, guys, if you guys need settings changed, I would check with your doctor to see if you guys can do your own settings change. Exactly how I showed you where the blower hours are. If you go to therapy, you'll be able to change the settings settings that way. There are other YouTube videos that show you exactly how to change those settings, but don't do that unless you get the okay from your primary care doctor. Again, bringing the machine to me, bringing the machine to a durable medical equipment provider where we're physically handling that machine is something you may want to avoid right now. Tip 6, especially for you new guys, order fit packs. Basically what a fit pack is a mask package like this that has every size mask available. It's completely sealed. If the small doesn't fit, you have a medium, and you have the same thing. If a medium doesn't fit, you can access a large or vice versa all the way. This is the Vitera. Actually, it was the first mask that I've seen that was a non-DreamWear type style, non-hybrid type of style, full face mask that are now doing the fit packs. Off the top of my head, some of the great fit packs that have worked very well for patients down here are the DreamWear collection, the DreamWear full face, the DreamWear nasal pillows, the DreamWear under the nose, and the Dream Wisp, obviously. Resmed P10 is a workhorse here. The fit packs are wonderful. Fisher & Paykel, I believe their entire line, including the Vitera I just showed you, have fit packs. So you guys, make sure you get the fit packs. And for you experienced Cpap users, when you're trying to use a new mask, get the fit pack as well, because a medium that might fit you in another brand, you might be a large or even a small in that other brand. Number 7, get the Lumen. Cpap cleaner that I've been introduced in the past 2 months. Am I downplaying the Virtual Clean 2.0? Absolutely not. That is a great machine, but one difference that I like with the Lumen is that you can clean your mask in your humidifier tank within 5 minutes, your key, your cell phone. I'm still number 1 on the Virtual Clean. However, number 2 with the Lumen UVC light. I think it's great for household items, including a quick 5-minute cleaning of your mask before you go to bed. I put the link below to the Lumens. Tip 8, make sure you always wash your hands before you go to bed, before you put on your Cpap mask. You handle your phones. You've been at work handling door handles. You guys are going to bed. You're touching your face. You have to make sure your paws are clean, all right? So make sure you wash your hands before you go to bed, before turning on that mask, because if you guys have a mask, you're adjusting it, you're touching your eyes, you're touching your face. Washing your hands reduces your risk of getting sick. For everybody who wears masks out there, whether it's healthcare professionals with the N95s, the public with the cloth masks, or you guys with Cpap masks, always wash your hands before you go to bed handling your Cpap equipment. Tip 9, negotiate your Cpap rates. If you guys are paying with cash, HSA, FSA, or you're submitting it to your insurance yourself, you can negotiate your own Cpap rates. I have patients here all the time who are saying, I need this at this price, and you know something? 9 out of 10 times we're able to undercut that price. So make sure you negotiate those rates. Never pay list price for Cpap. If you guys want to negotiate rates with us, info@usamedicalsupply.com. Send a link where you get your stuff. If we can compete, we can compete. If we can't, we'll tell you we can't, but 9 out of 10 times we should be able to give you a better price. That's it for now, guys. If I missed anything, please put it in the comments section. Make sure you guys join Cpap Nation. Hit subscribe. I just want to thank each and every one of you. You guys are incredible. Let's stay safe. Let's stay healthy, guys. Let's move forward. And I want to give a special thanks to all the healthcare workers, everyone who's on the front lines out there. I want to give you my deepest gratitude. I want to thank you from the bottom of my heart. No matter what you do out there on the front lines, whether you work at a healthcare facility, whether you work at a grocery store, no matter what, if you're dealing with the general public on a daily basis, providing services to the public, to me, you are on the front lines, and I want to thank you.